Hi there, this is Town of Islip Supervisor Angie Carpenter, and we're here in the town boardroom today really to recognize the efforts on behalf of our public safety community, our police department, our public safety, fire service, and certainly EMS, and the good work that they do for all of us 24/7, 365 days a year, they're out there. And one of the issues that we wanted to focus on today is the rapid increase that we saw because of COVID in overdoses. And we have gentlemen and ladies from these departments joining us, in addition to Mary Ann Pfeiffer, who is the co-chair of the Town of Islip Drug and Opioid Task Force, Mark Soto from YES Youth Enrichment Services, Tony Prudenti from our public safety, who is the Commissioner of Public Safety. And if you don't mind, if each of you, starting at my left, would introduce yourselves and the department that you represent.
Hi, my name is Jonathan Kricklava, Chief of Department, Central Islip Hot Dog Ambulance.
Number 4B, Assistant Chief, Exchange End of the Islip.
Alexis Citations of Recognition, President of the Top of New York.
Brian DeFore, Assistant Chief, Bishop of Investment.
Ron Bars, past President of Suffolk County Chiefs, as Chief of Hop Hog Fire Department.
Bill Murray from the Bay Shore Fire Department, representing the Town of Islip Fire Districts.
William Stanger, President, Islip Town Fire Chiefs Council, past Chief of the Islip Fire Department.
Robert Sutton, member of the Central Islip Fire Department, President of the Suffolk County Volunteer Firemen's Association.
Nick Luperoff, Vice President, Suffolk County Fire Chiefs Council.
Well, thank you all for joining us today. You know, there were some startling statistics that were shared with me that really are quite startling. During the first month of the COVID-19 pandemic, fatal overdoses went up 43% compared to the previous year. 43%. That is tremendous. And that there were 42 deaths in that 4-week period because of overdoses. And these people that you see before me are part of the organizations that are there to help make a difference with Narcan. And that has made a tremendous difference. This, in fact, 2020 was the highest rate of both fatal and non-fatal overdoses since 2017. And the amount of cases of overdoses in the county totally was 1,515 overdoses. And the total number for Islip for 2020 was 402. So that puts us at 26% of all of the overdoses in a county of 1.5 million people were happening here in the town of Islip. That really isn't anything to be terribly proud of, but I think what we can be proud of is the dedication of the people that you see before me who are trying to make a tremendous difference in that realm. Also, too, we have the task force that I spoke about, the Town of Islip Drug and Opioid Task Force. Councilwoman Mary Kate Mullins serves on that task force. She's the liaison for the town board. And co-chairing that task force for us is Mary Ann Pfeiffer, who's the Executive Director and COO of Youth Enrichment Services. Mary Ann, would you like to say a few words about the task force and your efforts?
Thank you, and thank you to all of the rescue workers for everything that you're doing to combat this terrible situation with heroin overdoses. The task force really has, we held a town hall 5 years ago when we began this process, and we really wanted to hear from the families and the community. And what we found was a big, big issue is the hopelessness and the feeling of helplessness when somebody is suffering from addiction, whether it's addiction to opioids, heroin, alcohol. So one of the key efforts that we did, based on a suggestion by Kathy Konigsdorf, who is the founder and director of the Jake K Foundation, thank you, and in honor of her son who passed away from an overdose, was a going purple concept that was being done down in a town in Maryland. We adopted that, and we are the first town and second place in the country, first in New York, to have our town go purple. And purple is the color of recovery, so from addiction, and it's also the color of mental health. So every September, we start on August 31st with International Overdose Awareness Day, and then we go right into the September month of recovery, where we decorate with purple, we give information to the school districts, because if you feel hopeless and you have no hope or helpless, this addiction stays in the closet. Addiction is in everyone's family, whether it's gambling, food, alcohol, shopping. There is some level of addiction in all of us, probably. So that effort is to raise awareness. And I know right before the pandemic, we had 3 young men who saved a life based on the fact that when we went purple the first year, which was 2019, they actually started having conversations in their school and in their community about heroin overdose. And I think Angie can tell that story. It's an amazing story, but it's something we should remember about these 3 young men from the Bayport Blue Point School District, that they recognized that somebody had overdosed while driving their car, and their car was kind of like moving off the road. They were able to look inside, and from that awareness, they were able to call 911. And that's what it's about, is that we're in this together. Islip has taken the lead on this. This year, Huntington went purple. Out in Greenport, where they had some deaths all on top of each other, and Brookhaven have all begun to go purple for September. So thank you guys for being there when people who are victims of addiction really need that, whether it's heroin, and I know you see a lot of other addictions, and rescue. So thank you all.
Thank you so much, Marianne. And as I said, she co-chairs the task force, and her co-chair is Drew Scott, who's a former newscaster with News 12. And Drew lost a granddaughter to overdose. And it really is so compelling when you hear someone who has firsthand lost someone near and dear to them throw themselves into the cause and try to make a positive difference over something that was so terribly devastating and negative for he and his family. You know, the Narcan saves in our community, in the county, have been tremendous. As I said, from 2017 to 20, the numbers kept going up. And to give you an example, in 18, there were 1,431 overdoses and 834 Narcan saves. In 19, 1,381, and there were 863 saves. And in 20, that number jumped. The overdoses were 1,515, but there were able to be 910 saves. And that is to the efforts of the people that we see here and all of those that they work with. In our own town, our Public Safety Commissioner, as I said, is here. Tony, I'd like you to come up and say a few words on how we are directly involved in that endeavor.
Sure. Well, here in the town, we're lucky, obviously, to have professionals, men and women, around us, and the ambulance companies and the various fire departments that serve the Islip town. But like the supervisor said, we also have our own peace officer academy here in the town. We train our own fire marshals who are peace officers and park rangers. And part of that training, they receive the Narcan training. It's a wonderful program. When you think about the numbers, like the supervisor said, the numbers really jump off because they're not just numbers, they're individuals, somebody's brother, sister, husband and wife, and it's staggering the amount of overdoses in the community. With the rise of COVID for the last year, the numbers increased as well. So we're lucky to have professionals here in town that have the life-saving Narcan equipped, and we're a great partner with our EMTs and fire departments.
Thank you so much. Thank you, Commissioner. So we would like to recognize each of these branches of service in our town for what they have done through this awful pandemic and with this scourge of overdose. And I'm going to begin with recognizing the fire departments of Islip Town. And Ron Bars, if you would, say a few words on behalf of all of the gentlemen and women that you work with.
Thank you, Supervisor Carpenter. This started from a gentleman up in Center Reach who was on the county opiate status, and he showed me these stats and figures, and it amazed me to see how many people were overdosing and dying from this. I had asked the supervisor if you would like to have something done for this and present something, because every time we read in the paper, it's always the hospital, the hospital, the hospitals. You turn around and look, it's the EMS service, fire service, and the police department are the first responders. They're the ones that have to get up at 2 in the morning, 3 in the morning, the middle of the night, the snowstorm, and go out. The hospital, you take them in there. They just take over what you started. I wanted to see these organizations recognized also, saying that they go out and we do what we have to do, and that is to save lives. Bill, do you want to say anything?
Said it all.
Okay.
Okay.
And I'll
Thank you so
let
much,
the EMS
Ron. And we would ask Jonathan, who is going to represent the EMS community. Jonathan is from the Central Islip Hop Hog Department. If he would please kindly say a few words.
Thank you, Supervisor. Yes, so Islip Town is one of the busiest when it comes to EMS calls in all of Suffolk County. The 5 ambulance companies alone do approximately 25,000 calls. With that being said, many of those calls are overdose calls. In light of the recent COVID pandemic, many of those overdose calls or opioid-related calls have kind of fallen to the wayside, meaning they're not getting the recognition that it once was. So it's good to recognize and show that there still is an opioid crisis and a addiction crisis out there. So that way everybody in the public knows that this isn't something that's gone away and that there is something it's very important to keep an eye on and to reach out to the community. So
Thank you very much, Jonathan. And in addition to wanting to say a public thank you to all of them, as Jonathan said, the opioid crisis has not gone away. If anything, it's gotten worse. So I would just urge anyone who's out there watching to, when you see one of these members of the services out there in the community, say a heartfelt thank you for all that they do. And please, everyone, be safe. Thank you.